The other really beautiful thing about the work that we do, because we're a nonprofit, we don't turn anyone away for an inability to pay for treatment. And I think that is an incredibly powerful thing when,
Yes.
you know, groceries are expensive and some of our patients have multiple jobs. We can
Mhm.
also see patients virtually through telerehab and almost everything that we do, other than massage. We haven't
Yeah.
figured out how to do virtual massage therapy, but we really are very intentional about meeting people where they are in this journey.
Welcome to Cancer Bites. Bold voices, big insights, and unstoppable energy. Because cancer doesn't get the last word.
I would like to just welcome our amazing guests that we have on this. Well, it's yes, afternoon my time here in Barbados. I always start by officially inviting all of our guests to Barbados to visit me sometime as part of this podcast. I don't know how we'll pull this off, but someday we're dreaming of doing a retreat of some kind here in Barbados. So we're gonna make that happen, Siobhan, for sure. So our show today features Liz Loreti and Dr. Janae Finley of Turning Point Breast Cancer Rehabilitation. And all of their information can be found on their website, myturningpoint.org. So we want to say thank you so much to our supporters and the caregivers and all our listeners who, our goal in having this podcast was to show, yes, cancer bites, but we can bite back and we can focus on some aspects of the journey of cancer and cancer rehabilitation that are not focused in illness necessarily, but are focused on how can we live with what cancer is and how can we support each other and tell the truth about this journey while building a community. So just some background, we have as our guests, we have Dr. Liz Loreti, the executive director, and we have Dr. Janae Finley, who's a survivor and a former patient, and now the assistant clinical director with Turning Point. So I'm gonna just turn the floor over to our guests because one of the things we like to do here is we like to listen. We have some core conversation topics, but we want to listen to what our guests bring to the table. So we would love to have each of you. You can choose whoever goes first. Say a little bit about what is it? How would you sum up what Turning Point does in the rehabilitation and the survivorship space? Maybe we'll start with Liz.
Sure. Thank you so much. Thanks for
Oh,
having
okay.
us. I'm Liz Loreti. I'm the executive director of Turning Point Breast Cancer Rehabilitation. I have been ED here since July. It has been a whirlwind, but it is so special. What we do for breast cancer patients and survivors, we do holistic rehabilitation. So, we are touching, physical health, mental health, social, emotional, everything. We do physical therapy, massage therapy, lymphedema screening, treatment, support, education classes, nutrition, exercise oncology classes. So we are really focused on the whole person. And I'm sure Janae will get into it later, but the patients that we see are so incredibly grateful because less than 10% of people are told that they need rehabilitation after breast cancer. And so this is a really sacred space for a lot of our patients.
Oh, wow, that sounds amazing. I mean, what would you like to add to that, Dr. Janae? We'd love to hear from you as well.
Well, thank you for having me as well. Again, my name is Janae Finley. I'm a physical therapist here at Turning Point. As of January 1st, it was 7 years here at Turning Point. So pretty awesome. You know, what Turning Point is kind of to piggyback off of what Liz said, it really truly is somewhere where patients feel comfortable. So there are many times where patients come in and half of their session is this just them opening up and them talking, sometimes crying, but it
Yeah.
provides this really safe space for patients to really kind of see where they are on their journey, figure out where they want to go on their journey, and then have all the support that they need to get to that end of their journey in terms of being on survivorship journey. I think for me personally, Turning Point really was like a turning point in my life, a time where I honestly felt really lost in life.
Yeah.
I was diagnosed at 31, but most of my treatments were when I was 32. There's not a
Oh,
lot of 31-year-olds out there with breast cancer. I had no one to talk to,
oh,
no resources, no support. So I just kind of bottled everything in and, put on a happy face and told everyone I was fine and I wasn't. And I think coming here, immediately they recognized it. Like, it's okay. If we know it's not, we know you're not fine. And it's okay that you're not okay, but here's how we can help you be okay. And I feel like for me, being able to go from patient to PT has really allowed me to connect with patients on a different level and really kind of help patients realize that there is another side to it. It is a journey. There is a light at the end of the tunnel. It's going to take some time, but you can definitely get there because here I am. So.
Oh, that is beautiful. I think this is something I'm noticing when I've spoken to our guests in the past, that there is a kind of gap in terms of the after journey or the journey of healing, and that there can be that sense of isolation after, you've been quote unquote cured, or you're living with, or your breast cancer is being managed. There is a lack of structure in terms of what to do next. So I think what you all are providing from that holistic point of view is really, really important. But I'm sure you all can say more about the idea of comprehensive rehabilitation as opposed to just rehabilitation after breast cancer. Liz, would you like to tell us a little more about how would you see the difference between those two?
Yeah, so I think survivorship can be a diagnosis in itself. And, when we're thinking about comprehensive rehabilitation and what we do, um, there women are underserved medically. I think that, if you are a minority woman or, fall into the LGBTQ plus IA plus community, you're also even further underrepresented. And we want to make sure that we're respecting people individually, that we're meeting people where they are. Breast cancer diagnoses and treatment plans and medication and how people show up after are all completely individualized. And I think
Mm,
it's so important for the survivorship journey to be tailored to their individual needs as well. Janae and the rest of the clinical team are so incredibly empathetic and compassionate when it comes to their patients and their service. And so, when people hear we do breast cancer rehabilitation, they're like, well, what is that? And
yeah.
so for us, we want to make sure that a patient is getting everything that they need. So, you know, we can refer them to our in-house counselor. We can refer them to our nutritionist. We can, clear them for exercise. Janae is actually part of multiple research studies that are showing amazing outcomes when you couple physical therapy with exercise. And so this comprehensive rehabilitation is truly just meeting people where they are and ensuring that they're not only surviving, but they really are thriving in this new version of their lives because you can never go back to normal.
Oh my goodness. I love that idea of renewal, and the idea it's a new version of their lives, and I think that's a nice and optimistic way to look at it, that's positive without being superficial, because it is a new version, right? And it can be very special. And I love when you mentioned that everything is individualized. So no one feels just like a number. And I'd love to hear, Janae, could you tell us a bit more about some of what you do in terms of the individualized treatment that you give?
So it's interesting that you say that. So we review all of our patients before we see them every time they come in. And you can have this whole great plan for your day, for your session. And then a patient comes in and completely throws your plan to the side and is like, this is how I'm feeling today. So the fact that we are so flexible and that
Mhm.
we are really able to be like, what do you want to get out of your session today? Forget the plan that I had. What do you want to get out of your session? What are you working on? What do you need outside of physical therapy as well? So, the nice thing about having so many services in-house is we can also, if there's gaps in the schedule, we can also be like, hey, there's a massage opening in 30 minutes after your appointment. If you want to stay, maybe get a massage, and that'll help you kind of in the mental space as well as the physical space. Sometimes we can directly then refer them to counseling as well. So being able to kind of give patients what they need on a case by case basis, but also on a day by day basis is also
Yeah.
something unique that we can offer that I love because everyone's going to be different on every session. One day they're going to come in and they're going to be super positive about everything. And then the next time they come in, maybe they have scans coming up and they're nervous or, anxious about some scans. So we can really cater their sessions to them. In terms of the physical therapy, most of what we do is actually hands-on. So we actually see our patients one-on-one. Most often we are in a room by ourselves with the lights very low, just to keep a nice, calm atmosphere in the sessions. We do exercise and things like that out in the gym, but the majority of our sessions are actually in the room with very low lighting. And again, and it's nice with that being able to cater to what they need. Sometimes what they need is just talk about their family, their friends, their kids, their pets, anything. And so anything goes here, which I really love. So kind of having fun with patients and connecting, but also making it something that they feel like they're getting something out of is really great.
Yeah.
Yes, it sounds as if that sweet spot of kind of holding space for someone, but also being informed to know what they need, but being willing to listen. It sounds like it's a really nice reciprocal process that you listen and want to understand better, and then they also want to hear and understand from you. Anything you'd like to add to that, Liz?
I think, again, the empathy and the compassion runs so
Yeah.
deep. The other thing that I really, really appreciate, and Janae touched on it slightly, but if somebody has ever experienced physical therapy, if they've torn their ACL, if they've had a hip replacement, you are one of many. You are, cycling through. It feels, it can feel rushed, it can feel impersonal.
Mm.
They are one on one with patients for an hour.
Mm.
That is their hour of time. The other really beautiful thing about the work that we do, because we're a nonprofit, we don't turn anyone away for an inability to pay for treatment. And I think that is an incredibly powerful thing when,
Yes.
groceries are expensive and some of our patients have multiple jobs. We can
Mhm.
also see patients virtually through tele-rehab and almost everything that we do, other than massage. We haven't
Yeah.
figured out how to do virtual massage therapy, but we really are very intentional about meeting people where they are in this journey.
That is fabulous because that was actually my next question. I was going to ask, how can people access your services? But to know that no one is turned away, I think it's really beautiful. And I think when you're feeling the isolation that cancer brings, and even the healing journey of after the aftermath, I think that's really incredible. And it sounds as if definitely from what you're saying, there are some gaps in recovery in terms of what is offered. And so many of you, what you say are filling those gaps, but I'd love to hear from your perspectives, either Liz or Janae, who'd like to start. What kind of gaps do you see most in the breast cancer recovery battle?
I think Liz touched on this earlier when she was
Yeah.
saying that essentially no one's really getting referred to rehab. And what's
Yeah.
happening is I think we're shedding some light on doctors and we're really getting them to buy into rehab, but there's still a huge gap in the time from diagnosis,
Yeah.
surgery to being referred to rehab. Here in our more of our suburban clinic, we get patients a little bit earlier. We've got a lot of doctors in this area that really get us and get what we do. So they're starting to refer sometimes even before surgery, which is amazing because we do have a
Great.
pre-op program.
Mm-hmm.
But in our clinic in downtown Atlanta, the difference that we've noticed there is that we're getting referrals, but these patients aren't being referred to us 3 weeks after surgery. They're being referred to us 3, 4, 5, 6 months after surgery, several years after surgery. And so they already kind of are starting not at square one, at zero. They're already kind of behind from when they start. And so there's more that goes into their sessions to be able to get them to the level that they need to be able to function, because we're already starting somewhere where you're tighter than most are at that point. Um, I think that's one of the biggest gaps. I think sometimes there are doctor buy-in are some of the gaps that we see,
Yeah.
but kind of also like a team effort. So sometimes we have patients that come in and they will tell us that one doctor said it was okay to come, but this doctor said they didn't want them to come.
Ooh,
And
ooh,
so there's a lack of like a team approach
yeah.
sometimes outside of Turning Point with all of the doctors on their actual um, team about being all on the same level with where rehab can help. I think there's sometimes they think that if my patients need rehab, then I didn't do a good job and it's a reflection on them. Whereas this is not about their
Mm.
surgery. This is not about their work. This is about the patient functioning at the end of the day and being able to be more like themselves before. So I think we're getting a little better, but I think the gaps with referrals is one of the biggest things that we see here.
Yeah, and it sounds that I could see, Liz, you're dying to jump in there and say a little bit about
Yeah.
that.
It's almost like a competition in a way. So we have so many of our surgeons and, healthcare professionals love the work that we do. They love the results that they see with patients, but they feel like they can't refer to us because they have an outpatient rehabilitation program within their hospital system. The reality is what we do is so incredibly different. And I have built a soapbox that I love to stand on. And I'm inviting people to our clinic to tour our space and to really understand what we do. And once these healthcare professionals see
Yeah.
exactly what it is, they're like, this is not a competition at all. This is way better than I envisioned. I think we should be sending more people here. So I really strongly believe that, we are doing the work. And the other thing is, we don't require referrals. People, a lot of our referrals come from other patients. And
Yeah.
so the patient needs to be their best advocate. The other sad part is, you know, breast cancer diagnosis rates are not slowing down. They're
Yeah.
gaining every single year. There is no shortage of what we need, but we are one of the only nonprofits in the country that is doing this work. And so I wish that there was one of our clinics in every single major city and rural healthcare system because we are incredibly needed.
Yeah. And I can attest to that. Even living in the Caribbean, there's nothing like that that exists here. I
Yeah.
think, as you say, it's not a competition. You're just two entirely different ends of a spectrum, which complement each other at the end of the day and can complement each other. It doesn't have to be one or the other. And I think that's something that, the more we spread the word about that, the better. And I think also, in terms of Janae, what you were saying, your lived experience, because when I introduced you, I said that you had been a patient. I would love to hear more about how your lived experience is going into, your role now doing PT.
I think I touched on it a little bit earlier, but I do feel because here's the thing, our patients are getting younger and younger. So now I am
Yeah,
seeing all of these 30-year-olds being diagnosed with breast cancer, and they're in the same position that I was in.
yeah,
They've got small kids, they've got full-time jobs, they're trying to balance all these things in life with a cancer diagnosis. And so I think for a lot of my patients, it proves that it can be done. It's going to take some help, and you're going to have to ask for help. But
yeah,
I have patients, most of my patients know that I have been a patient here. So a lot of times for them, it's like, okay, can I ask you a personal question? Can I ask you
yeah.
a personal question? How did you deal with this? And how did you deal with that? And I tell everyone, I'm an open book. So there's no bad question, there's no wrong question. If you had that question, I probably had the same question too. So I think letting patients really kind of see firsthand that there are other people that are having the same difficulties that they're having and are going through a similar situation. But I've had a child after having breast cancer, and I have a lot of patients that ask questions about IVF and freezing their
Mm.
eggs and, how I dealt with the emotions after breast cancer and having a child later. So I think just being able to connect with these patients has really been a true testament of what was, what is, and what your future can look like. And it's like we're family here. We always say Turning Point is like a little family, but we call our patients our family as well because we're like, once you come Turning Point, the joke is you never leave.
Yeah.
And it's true. Our patients continue to come back. Once
Um,
they're done with the PT, they may come back for exercise classes and counseling. They come back to our events. We have so many events, and then we have every summer we have an annual walk just to really appreciate
That's
our patients and
wonderful.
appreciate their journey and congratulate them on where they are. So our patients are like our family, come one, come all, and stay. So
Yeah, oh, that is beautiful. And I think, you touched on too what it really is the uniqueness of being a woman and that certain age and having breast cancer and being a caregiver and working a job. There's a level of juggling and a level of management that I think is quite unique to the experience as a woman. Liz, I'm sure you'd like to say a bit more about that.
Oh yes.
Yeah.
I see it on a daily basis as I'm sitting here doing this podcast in my car. Um, because I'm the mom of two young kids. You know, our staff, they it's an all-female staff, and I think there comes with, again, a level of understanding and flexibility. I will say not all of our patients are women because we do
Mhm.
have male patients.
Yes.
And we also support, queer patients and trans patients. And so,
Yeah.
but there's so much flexibility that has to happen in this job. And again, it's really meeting people where they are. I feel really fortunate to have the staff that I do, because I see the way that our patients respond to them. And there is truly no better place that I've ever worked, and no better staff than I've ever encountered with these phenomenal providers. So, um,
Oh,
yeah,
that's
that's just
amazing.
yeah, I
That's
love it. I
amazing.
love it here. I love
I
them.
can I can tell the authenticity. I can really feel it. And I think that's something, you mentioned your patients, but what about caregivers? If we turn a little bit to the caregivers involved in the journey, how do caregivers fit into the rehabilitation journey? I mean, Liz, I'll let you keep going and then we can have Janae jump in after.
Yeah, I think one of the things I did not think about when I started here was the caregiver journey. And the first week, I met a husband and one of Janae's patients, and he told me that he will always support us because we did for his wife what he couldn't do.
Mm.
And so seeing the impact that these women have, women are just supposed to get back to their lives and, deal with their pain and, suck it up. Childbirth is nothing, cancer is nothing. You just have to get back to normal. And when we're seeing these patients who are the primary, support for their family and the caregivers for their family, and now that is put on somebody else, you know, it is just really like I'm trying to think about how we better support caregivers and spouses and children, um, because it's okay for our patients who are dealing with, one of the hardest things that they will ever encounter in their life. It's okay for them to take a step back from buying birthday presents and from having the meal plan. And again, we want to provide as much support to our patients, but also, give them permission to take a step back and let somebody else assume the burden for once. And, those caregivers and family members also need support, and they don't have a place for support.
Oh, that's powerful. I'm sure you can add to that, Janae, particularly, when the idea of doing it all, because you mentioned that, people have to ask for help. As women, sometimes we have to be ready to ask for help and receive that help.
Yeah, and I know for the last several years, we have continued to kind of throw out there this like we need a caregiver support group
Mm,
or a once a month workshop or something like that for caregivers, not only a spouse, but a mom that may be taking care of her daughter in her 30s who has
yeah.
breast cancer, or a friend, children of survivors. I think coming from personal experience, it's a strain on relationships when someone is going through something and they don't know how to deal with it, so they don't know how to have people help them.
Yeah.
Um, Speaking of personal experience, like I know for my husband is not the most talkative person in the world. He's, not very emotional, but less than a
Mm.
year after I was diagnosed with breast cancer, his sister was also diagnosed with breast cancer.
Oh
So
my gosh,
someone who was not talkative at all, not really like expressive in emotions, really kind of hit a brick wall. So it was like two people hitting a brick wall at the same time. It's a strain, and it was a hard time, I'm not gonna lie, but I think as much as I felt I needed support, I think he also felt like he needed support, and we didn't know how to support each other. So having someone on the outside who can be like, okay, these are ways that you can support in this way for this person, and this is how you can support, this is how you can involve other family members, I think is really important. I don't like to ask for help. So I know part of that was on me. I try to do it all. I know now that I can't. So I'm better at asking for help, but sometimes we just need someone to tell us that. So
I know that's how we're primed as women. I mean, I do that. There's this idea that you have to always seem busy, you always have to be doing something as opposed to sometimes just being. And I realized how much of that I do myself, and I'm trying to model something differently. Like, the past few months, sometimes I'll try to consciously take the time to sit and just maybe read a book. And it was hilarious the other day. My son, who's 19, he comes out of his room and I'm there sitting reading a book, and he's like, wow, what are you doing just sitting around like that? And it struck me. Now he does that all the time, right? It struck me that he would actually ask me what's going on, and I realized, you know what? No, I really need to model that there are times when it's okay to slow down. I don't have to be doing everything, you know. And I think the services you give really help with quality of life, clearly, and help with, you know, the family connections that people need. Are there any? I'm sure there are many success stories. I mean, you've touched on some maybe. Are there any moments that keep the team going or success stories you want to share? Liz, I see you smiling, so and I'm sure you'd like to share something.
I love sitting in my office with my door open. And I can always tell when somebody, it's their first appointment. They walk in. My office is right by the front door. They walk in, they're staring at the floor. Sometimes they're hunched over in pain. And an hour later, they're coming out a completely different person. And I get to see that transformation on a daily basis. There are also patients who have told me that their breast cancer diagnosis was the best thing to ever happen to them.
Wow, that is
And
powerful.
I think about that because they've been able to reset what their life is like. They've,
Mm,
either some of them have ended unhappy marriages, some of them
mhm.
decided to quit their incredibly busy toxic jobs and focus on a passion of theirs. Some of them have uprooted their lives and moved, but
Yeah.
the the thing is that they're prioritizing what they need and what they want. And I think, again, as women, sometimes that doesn't happen. So I always love hearing the patient stories where this diagnosis was a reset, and really an opportunity to do things differently. And I mean, I am so incredibly grateful that Janae chose this path after her journey, because I really see her providing so much value as a survivor, as a former patient, and in the work that she does. And so, Janae, you're one of my favorite stories.
Oh, that's so
Thanks.
awesome. Oh, you guys are gonna make me cry. And I'll always remember you saying that, you know, breast cancer being the best thing that happened to someone. Janae, come on, you must have. How
Oh
are you gonna
gosh.
top that now?
We have a team approach here. So not just within the services, but within PT as well. So it really allows us to have multiple people get to know the same patient. And I would say probably one of my most favorite stories is Liz. You've probably heard us call her Wonder Woman, this patient that we love so
Yeah.
much. She was diagnosed when she was pregnant with breast cancer. And so she had chemo while pregnant because chemo does not pass through the placenta. So it's safe to have in the last trimester of your pregnancy. So she ended up having the baby early, just because she needed to finish treatment. Baby was perfectly healthy, just a tiny, cute little thing. And 3 weeks after surgery, she rolled in, baby in tow, and her other child in tow. And she still comes in like a Spitfire, fireball. Like she has not let any of this
Wow.
take her off her path in life. She still comes. Granted, she's probably sometimes like 20 minutes late because I think it takes her sometimes 20 minutes to get both of them in the stroller at this point.
Yeah.
Baby is, I guess, over a year now at this point.
Yeah.
But I just love so much that no matter what, no matter what's going on in her day, she still wants to come here, even if she feels like she's going to be late. She's like, maybe can I have the last 30 minutes of my session? But I remember when the baby was little, and she was bringing her in, and baby was in the room crying. And because we are so empathetic to women and what women are going through, there's like a little knock at the door
Mm.
saying like, I know the baby's crying. Do you want me to hold the baby? Was one of our other PTs. And she said, yes. Oh my goodness. Yes, please. And thank you. And all that therapist did, because she had a little downtime, was she just walked the halls with this baby for 30 minutes so that she could have her time. Her other child was busy like coloring, but I just, to be able to go through, I think my journey is interesting, but to be able to go through it while pregnant and
Yeah.
continue to lead this great productive life and be superwoman, and she's a great mom and her kids are amazing and they love coming here and we love to see them. She's probably one of my favorite stories. I think we may have honored her 1 year, or we talked about honoring her 1 year at one of our events, but she just, and she sings our praise and just says that she doesn't know where she would be without us. And I just love when she comes in
Oh,
and I see her on the schedule and I'm like, yes, 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 yes. I can't say give me the baby anymore. I say give me the toddler, but it's fun.
oh, that is so wonderful. Well, I'm gonna see if we can, look traffic. I would like to talk to you ladies all day, but I would love to hear, a bit more. At this point, Siobhan, I know you'd like to come in and give some of your impressions.
I would. What an amazing conversation you've all been having. And I am, I, I think what really got me was you started out talking about the safe space. I never realized as a breast cancer patient that that would be something that I totally needed, right? I've been doing a lot of crying lately because I'm in that phase, that emotional phase. If somebody would tell you that there's the diagnostic phase and then there's this elation phase because they've saved your life in some way and you're starting to go through the chemo, so you're feeling like I got this. And then the emotions, the waves of emotions. I mean, I went for my MRI and the lady at the front desk said something and I was like, I started crying. I was like, and she's looking at me, right? But I'm so emotional. This is just a period of time where I guess it's a release, right? And so I thought when you said that it's okay to not be okay.
Yeah.
Like that's exactly how I have to think of it. And I thought I was thinking that way until the mountain of emotion came and I, oh my gosh, how am I going to get through this? And the caregivers part, absolutely give them snacks. that's that's all John wants. So we do these gift guides. We started it during the holidays, and we've created two amazing gift guides, and we review products from brands that are and review them from the cancer patient caregiver point of view and or survivor actually too. So he sees all this stuff coming in the door, all these shipments of different things and like face creams and you know uh, body rubs and teas and coffees and things like that. He says, "Was there anything for me?"
No.
Like he's totally where are the snacks? So there was this one box from Packed on Purpose.
Oh,
Um,
yeah.
and I hadn't opened the box yet. So I opened it and it was like, oh, there's like honey and a little tea and a little mug and a little chocolate bar. And I picked up the chocolate bar and it was empty. It was just the wrapper. He'd found it.
Oh,
That was his.
There
So
was something for him
there
after
was
all.
something for him. He was like, this is really good chocolate. So where do we get this? I better get a crate of that. Um, so I have a laundry list that I want to talk to you after the show about. I think that we are probably going to be sisters for a long time and collaborating because I see ideas all over. I've written all kinds of things down. Um, and I love that you're doing this for free for people that just can't pull it together. I mean, women with breast cancer shouldn't have to work unless they want to. I started creating something, I turned my pain into purpose. And then Stacy jumped in and we created this and it's just going gangbusters. What it's going to look like in a year from now, who knows? But we were having fun with it and we're making a difference and we're getting gift bags out to women with breast cancer. So something I want to talk to you guys about. And we even now have our own jewelry line.
Yeah, yeah,
I just wanted,
yeah,
this is a shameless plug, but here is
yeah.
our jewelry line. Can you guys see that?
Yeah, it's
Yeah,
gorgeous and they're so
I
lovely
beautiful.
and
turn my
nice.
head, Blooms of Resilience. And it's created by Lindsay Gann of L. Gann Designs. And she approached us and said, I'd like to create a jewelry line. And well, she didn't say line, she just said earrings. So she did these pink earrings. And then one day she surprised us with an entire line of pink and purple earrings, necklace, and bracelets. 50% of the sale of this jewelry line comes to Cancer Bites. And we have, because of that, we have room for affiliates.
Yeah.
Wow.
So that line is exclusive to us, but we have room for affiliates, and they're pink and purple, and it's gorgeous. I mean,
Yeah, and purple's my favorite color, so I
it's
need
Me
to try to
absolutely
get
Janae's
gorgeous.
that.
too.
Yeah.
I think that what you're doing is incredible, and I
Yeah.
hope that we can help you expand into other regions. I think more and more
Yeah.
regions should have a Turning Point rehabilitation center that you guys lead and and help so many women. I mean, uh, the resources are hard to find.
Yeah, yeah,
The
they're very hard to find.
resources are hard to find, and I'm working on that. I'm a fundraiser, so that is definitely part of my plan. But honestly, my 20-year goal is to expand into other markets, and we just need capacity to do that, and also more physical therapists. Janae can tell you, but uh, PT plus oncology is not
Very small.
That's
it's
amazing.
it's teeny tiny.
Yeah.
And
Wow.
so I am going to brag on Janae one more time.
Yeah.
She hates this, but I think it's really important. The founder of our organization was a physical therapist and survivor, and realized the connection between PT and breast cancer rehabilitation. And so Janae will be presenting at the American Physical Therapy Association conference in Anaheim in December, or sorry, in February. Oh my gosh, I don't even know
Okay.
what month it is. But Janae will be presenting, and the importance of having physical therapists who also do oncology
Yeah.
cannot be
Yeah.
understated at all, because there needs to be more physical therapists who are okay seeing cancer patients.
Yeah. Wow, that's incredible. And I mean, it's showing us the importance of uh, uh I would say a non-traditional approach to medicine where there need to be more intersections. And
Yes.
as someone of Indigenous origin, that was the norm. Everything intersected, everything interconnected. And that false schism of oncology or physiotherapy we're seeing, it's not useful in this particular context. There has to be an integrative approach, right? And I
Yep.
mean, I think, yeah, Janae, you would be a great mentor to so many young girls who would like to, follow in your footsteps. I'm absolutely certain of that. That's
I love
amazing.
that. I mean, Jill is my mentor, and I'm not afraid to say it. She knows
Good,
it.
good.
But
She's our founder.
she's our
Yeah.
founder. She's my mentor. But I will say that the world of oncology, especially in PT, it's coming along. It's come a long way. When I was in school, the oncology training we got essentially was like, don't touch them. They were
Oof.
oncology patients. They're gonna break a bone. You just like caution, caution, like red flag and everything. And that was the gist of it. So I never really knew oncology was an actual like something that I could focus my career on until later. But with that being said, we've developed this really good relationship with one of the PT schools here in Atlanta. And so now we take PT students every year in the spring. We actually had one that just started yesterday. So we take a PT student as part of their advanced oncology elective. So they don't have to do this. This is an elective that they elect to take. It doesn't count as a grade for them, but we will take a student from there every year, and really kind of show them that don't you want to be in oncology? And we've had some really amazing students that are continuing into oncology after they graduate. So it's really cool.
Oh, that is brilliant. That sounds wonderful. Any closing thoughts for anyone? We're gonna look to wrap it now. As I said, we have so many other ideas that we can explore and ways that we can collaborate, I believe. And even, again, from a Caribbean perspective, we have the weather and we have the climate, we have
I'm
certain
ready.
elements of the
Right.
natural aspects. So
Sign me up.
to bring that, because as I said, there's so many of my friends and colleagues and people I know who have suffered from breast cancer, family members. And if you are privileged enough to afford to be able to go away, that's the only way really and truly you have a hope. or you have the ability to travel to the US and back, and not everyone can go to the US. So it's tough for a lot of people. And at the end of the day, I think, wow, what you guys offer would be amazing here. So I have that seed planted to someday be able to be here and help you all put that dream into a vision of reality, so that we can actually make it happen. And even before that, of course, everybody's welcome to come to Barbados, and you have to see for yourself. Think of it as a work trip. Think of it as, I mean, come on.
Oh, yeah.
Well, I'm the boss. Janae and I can just,
The
you know,
boss said it.
but
There we go.
not with our funding, because our funding really is
Yeah.
it's for our patients and to
Yeah.
keep medical costs affordable. So,
Of
we
course,
are lucky
yeah.
enough to do insurance for physical therapy, but again, cancer is expensive,
Yeah.
and we want to make sure
Simply
that
put,
people
yeah.
can afford this.
Yeah. Oh, that's wonderful. Well, at this point, I'm going to say, wrap up. And Siobhan, anything else you'd like to say? We, as I said, we'll have some follow-up calls and discussions for sure, because I see so much we can do together. And I want to thank both of you for your time, and your stories are really, I don't often associate such a feeling of hope and lightheartedness and also energy and vision with breast cancer. And I want this to be a new paradigm that we start, because it's possible to have that. So thank you both so much.
This has been Cancer Bites. Real people, real life with cancer. Take what you need, leave what you don't, and come back when you're ready. Cancer doesn't define us, but our voices do. On behalf of Stacy and Siobhan, see you next bite.